day, family. God bless you wherever you are tuning in across the world. Yes, it's time for Senior Talk with Clara Hubbard, your resource and information show for people getting better with age. Well, today joining us again is, let me tell you, they are kicking butt. I'm going to be clean about it. This company is called Zing Health. Zing Health, let me tell you, my Zing Health, they are our friends in the community. And let me tell you, you do not want to miss this phenomenal broadcast. Remember a few weeks ago, we had the very, very, very funny and most prominent, we call him now the Doctorpreneur, the founder of Zing Health, Dr. Eric Whitaker. He was with us introducing Zing Health and all the great work they are doing. So let me tell you this, we're going to take another turn because we have been blessed through our country to know that what Medicare has been extended. Their special open enrollment has been extended for many, many, many people who need it. So joining us today via audio, we're going to try to make it happen. She is joining us today. She is Teresa Lara. She's the Medicare sales manager for Zing Health. But what we're going to do now is take a quick commercial break from our sponsors, learn about who they are, and she'll introduce more about herself. And then we'll be right back here on Senior Talk with Clara Hubbard.
Zing Health is turning 65 and dancing the night away. Zing is getting your extra steps in. Zing is your trusted partner helping you navigate the Medicare maze. At Zing Health, we listen patiently to your health needs, personally guide you to the best Medicare Advantage plan, help you maximize your benefits so you can start optimizing your health today. Are you turning 65? Amazing starts here. Explore how Zing's Medicare Advantage plans help you feel amazing. Call 844-ZING for us or go to myzinghealth.tv.
Well, this year we started in January 1st, 2020 in Cook County only. Starting January 1st, 2021, we'll expand to 6 additional counties here in Illinois. And we're excited. We're going to be moving to also go to Michigan, where we'll be in Wayne County, Oakland County, and Genesee counties, and also to Indiana, where we'll be in Marion, Allen, and Lake counties. So we're only been in business going on 2 years, and we're expanding our footprint across the Midwest pretty dramatically.
All right, everyone. So we're still here with Senior Talk with Clara Hubbard, and I'm excited because Zing Health is doing great work. One of the things that I'm very excited about is that their programming is touching new dynamics in the community. We've heard from, as I mentioned, Dr. Whitaker a while back. He was on our program. You can go to Senior Talk TV or Senior Talk with Clara Hubbard on YouTube and see that broadcast. But what's important is that they're taking much more in-depth communication to the community. They have some services that I just am excited about. We talked about their Medicare services. We're going to hear from Teresa, but they also have some program that's called a critical care department. And so we just want to welcome our good friend. We've been busy. Let me tell you, we've been in navigation and talks and everything virtual that you can name since February, making this happen, because this is also known as Minority Health Month, and we appreciate everyone who is watching and tuning in. So welcome to Senior Talk, Teresa. How are you today?
I'm doing well. The camera, I'm sorry about that. I'm doing great, though.
We're going to work it out. We're going to work it out. So let's do this. People are going to see our smiling faces, and maybe that'll give us some little help. There we go. So here we are on a new dimension in care. Zing Health is a little bit under 3 years, but making major strides in the community. So as someone like yourself who is busy and knowing this is a very high impact time for you, being a Medicare sales manager, what can you say to the listening audience about your services, but most importantly, to those who know they need to even think about this special enrollment period, because we're letting it go when we know we need it?
Okay, yeah, absolutely. So, well, the special enrollment period, usually, so there's various acronyms, okay? And right now we're in what you call the lock-in period. Okay, we just passed up the open enrollment period, which was January 1st through March 31st, okay? And basically that was for anyone who enrolled in a Medicare Advantage plan and wanted an option of either going back to original Medicare or if they wanted to enroll in a different Medicare Advantage plan, okay? So we just went through that period. So right now we're in what you call the lock-in period, okay? So individuals who didn't make any changes or who only have original Medicare, they're pretty much locked in until October 15th, when people can actually initiate changing, initiate the annual enrollment period, which is when people start choosing different plans, or they could stay as they are, and their new plan benefits would begin in January. So that annual enrollment period would start from October 15th through December 7th. So as of now, through October 15th, from the beginning of the 1st of April through the October 14th, I should say, that's considered what they call the lock-in period. Mm-hmm. So unless someone has Medicare plus Medicaid, or unless someone has Medicare plus LIS, which is extra help with medication, if they have a program such as one of those, then they qualify for those special enrollment periods, and they can actually enroll into a different health plan quarterly, once quarterly, every quarter, okay? Mm-hmm. Now, you brought up a very important point, which is our chronic special needs plan. And that one is very important because that one actually does provide a special enrollment period throughout the year, okay? So if someone has been diagnosed with a chronic special, with a chronic condition, okay? And in this case, we're talking about, for example, diabetes 1, and as well as type 2, right? And we're also talking about cardiovascular disease, okay? And then as well as congestive heart failure, then individuals are actually able to enroll into what is known as a chronic special needs plan.
Okay. So here's the deal.
Mm-hmm.
People wait until 1 minute before the cutoff to apply. I mean, there's so many resources available. And more importantly, what our community needs to understand is that you're entitled to this benefit.
Yes.
And so why don't we participate? Why don't we get on board much earlier? Can you help us think about that term? The reasons for that.
Yeah, and that's one of the things I'm glad we're here with you, Clara. This is very beneficial, especially for our senior community, and I'm glad you have this amazing show because we need to educate. And the easier it is for the community to access this type of information at no cost, obviously, then the better it is, the better it is for everyone. So to answer your question simply, one of the reasons people don't take advantage of it or they wait for a long time is because a lot of people are scared or they're not aware of it. Or they're saying, if I get into this, what's going to happen later? Is this going to be interrupted? Is that going to be interrupted? Will my medication, et cetera, et cetera. So all these concerns, start, coming up, and then next thing you know, you just sat there and did nothing. You got flustered with everything. So one of the biggest suggestions or pieces of advice that I can give to anyone who's going through something like this, or where they feel a little overwhelmed, or when they just don't know, is to reach out, and actually have someone sit with you and go over that information. Or they can give us a call too, Clara. I have no problem with that. They can give us a call. And one of the things that we do is we actually sit down and explain everything in detail. Yeah. So in this case, we're talking about someone with one of those conditions, with chronic condition, right?
Right.
So as we go out in the community, because we do a lot of grassroots marketing, right? We're working with all different types of communities, and as Dr. Whitaker mentioned in his last interview, we're now covering Indiana, Michigan, as well as, various counties in the state of Illinois, right? And
Right.
so with that being said, the more we're out there, the more we find out that, people are not aware that in this case, for example, if somebody has a condition such as diabetes or cardiovascular disease or congestive heart failure, I mean, they're not aware that they can probably enroll into an Advantage plan.
Exactly.
And so what these plans do, they actually help cover costs, high costs that individuals are paying for doctor visits, specialist visits, their medication, which is huge.
Let me tell you, I'm about to scream inside. There is something called a Medicare savings supplement, something of that nature. And let me tell you, I know this very clearly. That's why it is critical that whoever is tuning in and watching, go to Senior Talk Media and please visit the second tab and see our Medicare resource experts. Let me tell you, a gentleman called me last year during the annual open enrollment period and said, "Oh my gosh, Miss Hubbard, thank you for this show. I am a diabetic. I am a 2-time stroke survivor. I was literally paying $300 for medicine. The expert on our show was able to help him with the savings plan. This gentleman is paying, and I can quote him directly, literally only $8.37.
Yeah.
That's where the savings is.
Exactly.
So this is the time where we have now to call the experts and use the number here for the Senior Talk number for Zing Health is 833-946-4937. Again, 833-946-4937. I know this to be a fact. And before I even mention it today, I called and he is still using that service. So just like he is coming out of pocket.
Yeah, absolutely.
$300. So he has saved quite a bit of money per month.
Absolutely.
On that one plan that he is entitled to, that all of you who are 65 and better may be entitled to. This is the perfect time also to review what you have.
Exactly.
See if it's the right plan. Some things may have changed. And what I really love about what you're doing at Zing Health is that you have something called, as we mentioned, this critical care unit. We are still living in the pandemic. Hello, mask we're still wearing. Thank God for our president. We are at 99 days. I think tomorrow makes his 100th day in office. Let me say this. Our disparities are still in place. Heart disease, diabetes, cancer, all these things still have to happen during this pandemic. And some of us may or may not have been attentive to those needs. So it's the right time to call a Medicare sales expert through Senior Talk Media. Call my friends at myzinghealth.com at 833-946-4937. So knowing that I'm this passionate about this one critical piece, Teresa, are there testimonies you can share, or just tell us a little bit about that unit? And then if you even will have information, why Zing stepped out? Because I don't hear many other organizations talking about critical care.
Well, that's a really good point, Clara. And one of the things is that in our communities, African American as well as Latino communities, there's a lot of education that needs to take place. And this grassroots marketing and Zing stems from this. We stem from wanting to come out to the communities and educate, not just, everyone who finds themselves in a position where maybe they're hesitant to ask their own children. Maybe it's just word of mouth that they hear things. And, there's always those people who want to know a little bit more, so if we can come out to the community, and in this case, for example, what you do, Clara, and if you're seeing that there's a need and we're actually out here and you're listening and you're saying, hey, my community needs this, and we're ecstatic to actually jump on board with different organizations that are collaborating to make our communities better, right?
Absolutely.
And so, and then as well, not just our senior community, but the children who take care of them. In this case, me taking care of my father, that was a big thing. Had absolutely no clue what Medicare was, and I came into this industry because of him. So understanding and being able to nurture our seniors in a different way, understand that they're going through changes just like we all do. And so I think it's a beautiful way to keep a family together, as well as, educating everybody on top of that. There's more understanding, there's more comprehension, there's more compassion.
Yeah, that's a good one. Now let's talk about that. If you can share, if care to be a little personal, because that's one of the things that we're facing now. A lot of us who are in, I don't know what this age is. I'm not Gen X, but I'm something up in there. But anyway, there's a lot of us who are now having to look at services for our loved one. And then we come up with this term Medicare and we are at a loss. I don't some people look A, B, C, D, every alphabet there is and don't know parts and all that stuff that comes with it. And so that's why it's advisable, if you're having a family member or if you're a caregiver or if you're just in the company of someone who needs care, to definitely visit Senior Talk Media and also use our friends at My Zing Health, because this is the time to ask the questions and get knowledge. And I also am encouraging those who are tuning in, put us in your restaurants and businesses at 12 noon Central Time, 1 p.m. Eastern, because this information is valuable. But Teresa, working from where you are, what were the needs that made you jump into this arena? Because I know other people who said, seeing the lack of care in my community, I became an advocate. So how did that come about for you?
Okay, so as I mentioned, my dad had consecutive strokes. And so when I saw my dad like that, we had to move on his health care. And unfortunately, we know that a lot of older people, they don't want to bother their children with, they don't want to burden their children with anything. Right. So as a family, caring for your loved one, you don't wait for them to say, hey, yes, I need this. We want to take initiative in learning, right? Mm-hmm. So those were the steps that we're taking. And then obviously educating, going to that Medicare office or going online and saying, hey, this is how I can help my family, and then a lot of times, Clara, one of the things that we do, or that the benefits consultants do, they find themselves, in our communities, especially if it's a son or a daughter taking care of their parents. I've been to presentations where a whole family's there, and we're only going to enroll the parents, but everyone kind of jumps on board so everybody can, get involved and understand. So I think a big thing is, one, this stems from, obviously from what you see. You can't pretend you don't see what the need is out there. Okay. Right. And after working with the community, as long as you have, you start seeing different pockets that are missing certain pieces of education, right? So you want to make sure that you're reaching out to those pockets in the community and providing them with detailed information. Right. And in this case, presentations, your show.
Let me say this. Let me say this, Teresa. So we have communication out. I am telling everyone. Mm-hmm. Zing Health, look, if you need a Zoom meeting, they'll put a Zoom together. There is just no way possible. Some people need groups. You have church affiliates. They're getting together socially. They're doing bingo. We'll put this Medicare piece a part of that. You have large groups of communities who are tuning in and watching and listening. Please do not deny our service coordinators across the city of Chicago. I'm working with the CAPS departments. I have sent this out to everybody I could think of possibly. This is a critical time, specifically while we have an administration that is working to give us as many resources as possible. Yeah. Please don't deny ourselves this opportunity. So let me say this. Now I'm not saying this is your father, but sometimes our older Americans, as we call them, people getting better with age, they are a little stubborn. So how did you have that conversation, knowing as as close as you are to your loved one, and you still seeing this advocacy that's in your lap? How did you say, hey, let's review some things and move forward? And how receptive were they to it?
Well, my father falls into that category of stubborn sometimes, He absolutely did. He was very receptive. He actually appreciated the fact. There's more frustration on their end than we can imagine. There's frustration at the fact that they don't understand the material, sometimes in a different language, sometimes just the material itself, okay? That they don't understand it. There's a lot of information to be reviewed. And even for someone my age, for example, even to now, there's so many changes taking place every year, with the rules, with the increases in the premium cost, the cost of Medicare itself. There's so many changes that are taking place, and it's hard to keep up. So people kind of just throw the towel in. So most people are very appreciative of the fact that you're going to sit down, you're going to explain what Medicare is, you're going to explain if they qualify for different programs that they may get assistance in paying for their medication, or in paying a 20% that Medicare doesn't cover. Yes. You're going to get information on what's the difference between this Advantage plan and a prescription drug plan and a Medigap plan. I mean, when someone sits down and actually goes over all of that information, you kind of have some weight lifted off your shoulders,
That's right. So that makes a big difference. And speaking of my previous interview with Dr. Whitaker, I mean, he was as transparent as possible. Mm-hmm. You all have a great leader in Dr. Whitaker and the team. And big shout out to Mr. Stephen Martin. We love you. Thank you very much. And to my friend Maria McGee. You got a strong team. These are my friends, y'all. I'm excited.
Yeah, they're great.
And definitely Teresa, we want to make sure. Now, let me ask you this. This is something that you mentioned. Do we have communication about Zing Health in Spanish and other languages?
Yes, absolutely. Yeah, we're working on actually putting together more material that people can actually review. So yes, that's a big piece that we're currently working on right now.
Fantastic. And as I learned too, also being in this platform of bringing this communication, I'm soon working to have a sign language interpreter. Because I've done interviews in the past over some years, just one time with a gentleman who was hearing impaired. Mm-hmm. And as long as he can read the audio part, or the subtitles, I'm thinking here it is another group of people that I could serve. So I'm excited, and I'm planning to learn sign language. I am putting that out there. Yes, I am planning to learn sign language. Yes, I am. So what we're going to do now, we got some new people who are tuning in. We're just going to replay the commercials once again. Everyone stay tuned. Take a quick commercial break. We're going to hear from our friends and partners today from Zing Health. Everyone stay tuned.
Zing Health is turning 65 and dancing the night away. Zing is getting your extra steps in. Zing is your trusted partner helping you navigate the Medicare maze. At Zing Health, we listen patiently to your health needs, personally guide you to the best Medicare Advantage plan, help you maximize your benefits so you can start optimizing your health today. Are you turning 65? Amazing starts here. Explore how Zing's Medicare Advantage plans help you feel amazing. Call 844-ZING for us or go to myzinghealth.tv.
Well, this year we started in January 1st, 2020 in Cook County only. Mm-hmm. Starting January 1st, 2021, we'll expand to 6 additional counties here in Illinois. And we're excited. We're going to be moving to also go to Michigan, where we'll be in Wayne County, Oakland County, and Genesee counties, and also to Indiana, where we'll be in Marion, Allen, and Lake counties. So we're only been in business going on 2 years, and we're expanding our footprint across the Midwest pretty dramatically.
All right, everyone. Welcome back to Senior Talk with Clara Hubbard. So excited. Teresa, we've done a great job today. I tell you, even though we don't have the picture, we have your smiling face with your cute outfit on and lipstick on it. So we all right. We all right. And let me say, a big month is coming up. May is Older Americans Month. Let me tell you. I'm very excited. It's also the 10th anniversary of Senior Talk. We got a whole month of parties and a whole year to celebrate the 10th anniversary of Senior Talk. Zing, myzinghealth.com is going to be in the community with us, and I'm very, very excited. So, Teresa, we have about 3 more minutes. What is your closing remarks for our community of listeners and viewers today?
I want to make sure that people feel comfortable in calling us and contacting us. If they don't feel comfortable with family members, if they just need to understand what Medicare is, we're more than happy to either get on a phone call with them or a face-to-face visit. And it's the most important piece of this, because we want to make sure at the end of the day that a person is making the best decision for themselves, the health decision for themselves. Is it going to be Zing for everybody? Obviously, we hope so. Obviously, we hope that everyone calls us,
Yes.
But is that the truth all the time? No, it's not, It's not always going to be the right fit for everyone, but that's what we're striving for. So, just for people to make sure that they, if they're hesitating to get any information or learn a little bit more about it, just to make that phone call,
Absolutely.
Reach out, and I guarantee there's someone who's always willing to help.
Absolutely. So the number to call is 833-946-4937. Again, 833-946-4937. And please remember, as Teresa said, one of the things that I really want the community at large to know is, so please don't be intimidated by the question you may have. They are there to answer that question. That is their job. So you are entitled to these services. They belong to you. You've worked for them. And if you're currently under a plan, this is the best time to review what you have. You may be qualifying for a Medicare savings plan. Like I said, that plan, that gentleman, I almost want to hug him through the phone. He was just trying to hug me as much as he could to say, I was paying $300. Now I'm paying $8.37.
Yeah. And Clara, there's so many. Yeah. I'm sorry. There's so many benefits, the dental, the vision, the hearing, the transportation, the gym memberships at no cost. There's just so much that the advantage plans have to offer. So yeah, absolutely.
And I'm glad you mentioned that. So there are multiple things that you're entitled to. I like the dental, and you said vision too?
Vision, exactly. Hearing aids. Weight Watchers programs, their gym memberships, medication actually delivered to their home. Yeah, transportation, worldwide emergency coverage. Yeah. So, and again, it's at no cost. So
that's good to know. A whole umbrella of services that you're entitled to. So definitely visit myzinghealth.com or call 833-946-4937. Visit Senior Talk Media. You'll see our previous broadcast with the co-founder, Dr. Eric Whitaker, a friend of Senior Talk. You're going to see Teresa's upload on Senior Talk Media in a few short moments. And let me tell you, give them a shot, give them a call. The critical care piece, I'm cheerleading for it. I promise you, if you need a spokesperson, I will push the critical care. I know how it is in our community and how we tend to delay what we need for ourselves, and it's available at no cost. These services are entitled to you. So if you're also interested in a group presentation, IV telecon, or a Zoom presentation, our media partners and all of our partners on Senior Talk are available, definitely in regards to this Medicare special enrollment period. Now, Teresa, what is the final date? Do we know what the final date is? I saw 2 dates. I want to be kind of sure where we're working. What's our final date right now?
So right now is the lock-in period. So, so actually someone who's has a chronic condition can enroll throughout the year. There's no date in particular. And we can go over details with that individual.
Sure.
face to face or over the phone, because everybody's a little different. But yep, the most important dates to remember that we know are up and coming is going to be October 15th through December 7th.
Mm-hmm.
And that's the next one. That's the one that's after this lock-in period, which is where we are right now.
Okay.
April 1st through October 14th.
Okay, fantastic. All right, so we got time, but we don't have time. So don't wait and don't delay. How about that? All right, everyone. So it's been a pleasure. Thank you all for tuning in and making us a part of your day. I am the host, Claire Hubbard. Our co-host was Teresa Lara, Medicare Sales Manager of My Zing Health. Give them a call at 833-946-4937. Can't wait to see you all next week. So much great things to share. But let me tell you, for more information on how you can be a part of this program, through our services. If you have a product, business, or a service that can directly benefit people getting better with age, which are known as seniors and veterans, please give us a call at 312-428-6919 or visit seniortalkmedia.com. As we say in closing, in complete darkness, we are all the same. It is only our knowledge and wisdom that separate us. Don't let your eyes deceive you. Everyone have a great day. Check on a neighbor, check on a friend, or give a smile. And we will see you next time for Senior Talk with Claire Hubbard.